Yeah. Or a large towel.
Oh. All right, we'll give it 1 second to get everyone in and then we'll get started. All right, welcome everyone. Thank you for joining us today for our COVID-19 update. A few quick little housekeeping. We do have the Spanish language option for those of us in the Zoom if you want to adjust your language settings, as well as the ASL if you want to adjust any video. And for today, we will, as usual, start with the presentation and then move into the Q&A portion of our day. For the question and answer, we'll use the raise hand function. And now we'll go ahead and get started. So our participants today, we have Dr. Rachel Herlihy, State Epidemiologist, Scott Bookman, COVID-19 Incident Commander, and Dr. Eric France, Chief Medical Officer. And I'm going to go ahead and start with Dr. Herlihy.
Great, thank you so much. Good afternoon, everyone. Thank you for the opportunity to be here with you. So starting here, as we usually do with our case counts, this figure shows you our daily trends. You can see with each of the gray vertical bars, the number of cases that have been reported in the state since the beginning of the pandemic. The gray bars show you those daily values, and then the red line is showing you our 7-day moving average to help smooth out the trend and help us see a little bit more clearly what's happening over time as far as a trend. So if you look at the far right end of this figure, one of the things that you'll notice in the last week or so, we have started to see a slowing of our decline in cases. So while we're continuing to move in the right direction here in Colorado with a continued decline in the number of cases that we're seeing, the steepness of that decline has slowed a little bit. So we're seeing, a little bit less of a steep downward trend than we had been seeing several weeks ago. Next slide. And this slide is specifically showing you Colorado's position, our rate compared to other states in the country based on our 7-day cumulative incidence. This is a little bit different than what we saw last week. Last week, Colorado's position was 11th or 12th. We have moved up a little bit here. So we're now the 19th from the bottom as far as the lowest rates in the country right now. And I think that has to do less with rates going up in Colorado, but really more to do with the fact that there are some other states around the country where rates are continuing to decline a little bit more rapidly than they are here in Colorado right now. Next slide. This figure is showing you our hospitalization trend. So you can see that compared to late November, early December, we certainly have seen a continued downward decline in the number of hospitalizations occurring here in the state, and do continue to see a strong downward trajectory in the number of hospitalizations that are occurring on a daily basis. Next slide. This figure shows you the difference between hospitalizations in Colorado compared to the US. So similar to cases, one of the things that you'll notice is that the steepness of Colorado's line for the last week or so is a little less steep than what we're seeing in the US. Overall, though, we do continue to have much lower hospitalization rates here in Colorado than in most parts of the country right now. We also started to see a much earlier decline in hospitalizations and cases here in Colorado than we did in the rest of the country. Next slide. Finally, I want to talk a little bit about variants of COVID-19, specifically looking at the numbers we're seeing in Colorado, and then talk a little bit about some terms that we're using. So right now, we've identified 41 variants of concern. These are specifically the B117 variant, also known as the UK variant, and we have seen 16 variants under investigation. All of these are the L452R variant, sometimes also known as the California or Denmark variant. So these variants under investigation, this L452R strain, should not be confused with another variant that is circulating in Denmark. There has been a little bit of confusion about that this week. So I want to specify that this is not the Denmark cluster 5 variant that's been associated with mink. This is the same variant that we're seeing in California. It's just been identified both in Denmark and California. So the difference between these two terms, variants of concern are really labeled as variants of concern once we identify specific characteristics about these variants that give us concern that they might spread more easily, perhaps cause more severe disease, decrease the effectiveness of treatments or vaccine, or perhaps be harder to detect using currently available diagnostic testing. So once we identify that those particular characteristics might be associated with these variants, that's when they're labeled variants of concern. On the other hand, variants under investigation are these variants that do seem to be clustering, causing outbreaks or clusters of cases around the country or different countries, but specifically haven't been identified as variants that are associated with any of those concerning characteristics that are listed under the category for variants of concern. So again, we have 41 variants of concern in Colorado. Those are all the B117 or UK variant, and 16 of the L452R California or Denmark variant. And I'll hand it to Scott. Thank you.
Thank you, Dr. Herlihy, and thank you all for joining today. I will give a brief update on our vaccine work around our distribution, our clinics, and then an update on our call center. So this week, as of noon today, we have received approximately 160,000 first and second doses of vaccine this week. And by the end of the week, we anticipate receiving a total of 177,000 total doses. This is both first and second doses as we move to a single inventory system in Colorado. Yesterday, the Biden administration announced that the national allocation of vaccine this week will go from 10 million doses to 11 million doses. And Colorado will receive our proportionate share of that increase in vaccine in the coming days and then into next week as well. The Biden administration also announced that the federal retail pharmacy program will allocate about 1 million doses nationally. And that's approximately 17,000 additional doses that will be direct shipped to 25 pharmacies within Colorado. And so we do see some hope here as we see an increase in the doses that are being announced at the federal level. We know that those doses are in addition to about the 90,000 new doses we receive each week and expect to receive in the coming weeks. Our vaccine supply is still limited at the federal level. And while we see hopeful signs of the increasing amount of vaccine that is coming into our state, we do still need to continue to do our work on phasing to ensure that we are prioritizing the right vaccine for the right people while we have this incredibly limited supply. And so our immediate goal continues to be vaccinating those who are most vulnerable, particularly focusing on those who are 70 and up. As of today, we are 73% towards our goal of vaccinating 70% of Coloradans 70 and over by the end of February. So we are, as of today, almost halfway to vaccinating all 70-year-olds and above in the state of Colorado. On Monday, we started vaccinating people in phase 1B2. This includes school teachers and staff, licensed child care facilities, those who are 65 and over. And as of today, we estimate that 27,000 people between 65 and 69 have received vaccine since Monday. We know that ensuring access to this vaccine to all who need it is a critical part of our work. And so we are working with our partners, our local health agencies, our providers across the state to ensure that we have access to vaccine for all. And so we've partnered with UC Health, National Jewish, SCL Health, and Centura to stand up mass vaccine clinics across the state. We're also working on specific health equity clinics. We have 18 scheduled for this week alone that they will distribute more than 6,000 doses of vaccine. And in the next 2 weeks, we have plans for more than 50 specific equity clinics that will distribute more than 25,000 doses. We have completed clinics at this point in Pueblo, Rifle, Denver, Aurora, Commerce City, and Pueblo. And we are looking at future clinics throughout the state, including Durango, Lafayette, Ignacio, Pueblo, and Lakewood. So we want to thank our partners at the local level, our providers for working with us to ensure that we're getting all of the equity work done to the best of our ability as we roll this out. And finally, I'm proud to announce that the state call center 1877 COVAX Co has dramatically increased staffing. We're now operating 24 hours a day, 7 days a week. We have more than 200 staff members taking call, and the average wait time is now down to 9 seconds. And so the call center yesterday handled more than 2,000 calls to ensure that we are doing all that we can to provide Coloradans with information about where to receive this vaccine. So I will now turn it over to Dr. France.
Thank you, Mr. Bookman. Good afternoon, everybody. So I'll just summarize for today, and then we'll open things up to questions if I can. Good news is we're making great progress. Over half of 70-year-olds in Colorado are now vaccinated with their first dose. We know nationally over 80% of all deaths are occurring in people 70 and older. So this is really good work that we're doing that will help make sure that our hospitals are able to manage as we go forward. We've also seen, as you saw from Dr. Hurley, great reductions in cases across the state of Colorado, over 80% reduction since our peak in mid-November. And so accordingly, we have the opportunity to look forward and feel like the light is at the end of the tunnel. Now, in the meantime, it's important that we all continue to practice our safe behaviors while we await our turn to be vaccinated. We know the vaccine is very effective and is very safe. With millions of doses now given, it's only reinforced the strong safety story with these vaccines. Once you're actually at the site, of course, you'll have your opportunity to get vaccinated. You'll receive a little vaccine card. It'll be important that you keep hold of that card. And we'll also, of course, monitor you at the site for 15 to 30 minutes to be sure you don't have any immediate allergic reactions. After, of course, over the first few days, you may have fevers, chills, achiness, generalized malaise, and that's expected. That shows that the vaccine is reacting and you're responding appropriately. So that's what you should be thinking about. I'm hopeful everyone will be patient as we work through each of our groups going forward. Next slide, please. In the meantime, of course, let's not forget the basics. Always wear a face mask, washing our hands frequently, and staying at least 6 feet away from others. You're probably aware today that we've gotten some new news about the value of potentially using 2 masks or double masking when it comes to being protected. And the findings in the new CDC study align with what we've been saying, which is that a quality filtering mask that is well fitted will reduce the amount of aerosol you produce as well as protect you from the aerosols that you might come into contact. We know, for example, that the respirator N95, which fits very nice and tight across the face, has both strong filtration and a great fit. And the goal, of course, is to try and create the same mask experience with something a little more simple and more available. These procedure masks, however, run the risk of having leakage on the side. The science today that the CDC shared was just showing us that if you can create a better fit with less leakage, you're less likely to spread through aerosolization or to receive aerosols. And they did this by either making a modification to this mask or using a double mask system. By tying a knot at the base of the mask, bringing the 2 corners together with the knot, And then tucking in that corner, you create a mask that now has fewer leaks along the sides. And so this mask was studied in the report today and found to reduce the spread of aerosols when worn by somebody who's coughing. The other finding was that if you were wearing a regular mask and wore a second mask on top of it, this would also help make sure that the fit was nice and tight and would also reduce the amount of spread of aerosolizing particles when you cough. So it's all good news. It says that if you're wearing a mask and if it's nicely fitted, either because of the modification you've made or a doubling of the mask, you will help prevent the spread of aerosols that may contain COVID. So it's our role over the next few months as Coloradans to be sure we're doing everything we can to reduce the spread. Even after being vaccinated, we should be wearing masks when we go outside. And if you don't have a well-fitted mask, consider wearing two that you know should help in that closure of those open spaces. Heidi, with that, I'll turn it over to you.
Great, thank you. And thank all three of you. We appreciate your expertise so much. Now we'll go to the Q&A portion of this. We're going to use the raise hand function. I know some of you may not see it where you normally do, so we'll help troubleshoot that for you. For today, if you have any questions outside of what we discussed, maybe even some Dial 2.0 questions, if you want to send those over to media_info@state.co.us. And my goal is to get through as many of you as I possibly can. So I'm going to take first round questions first, and then we'll go to follow-up. And so if you could say your name and the outlet you're with, that would be wonderful. And I believe that's Rob. I'm going to take it over to you.
Hi, Rob Lowe, Fox 31, Denver. Curious, when you talk about these variants being more contagious, what does that mean? Should people now be 8 feet apart instead of 6 feet? Should they limit close contact to 5 minutes instead of 10 to 15, we've been told in the past? What is the guidelines or suggestion to the public, and what makes the variants more contagious?
Thanks, I can take that question. It's a really good question. So what we are learning about these variants is that they seem to have a stronger binding affinity to human cells, specifically this B117 variant or the other variants that have been identified that are more transmissible, meaning that they are essentially a little bit more sticky. So the virus sticks a little bit more strongly to human cells. And so that potentially can result in smaller number of virus particles being able to cause an infection. And again, that translates then to potentially increased transmissibility. Really what we know is that the strategies we've been using in the last couple of months are really the same strategies that are going to be effective at decreasing transmission of the variants. So maintaining at least 6 feet of distance. We don't think this virus would necessarily travel any further than other COVID-19 variants might. Mask wearing, specifically as Dr. France, I think illustrated today, is really important. Making sure that masks are fitting well continues to be an important strategy. Limiting your contact with individuals outside of your own household, certainly avoiding travel whenever possible. Those are really all the things that we need to continue doing right now.
Great, thank you. Meg, I'm going to take it over to you.
Hello, this is Meg Wingeter from the Denver Post. With the surveillance variants, is there enough data at this point to get a picture of how widespread these are, and if it's still just kind of scattered cases, or if we are starting on that curve?
Thanks. So we feel like we have pretty decent coverage in the state right now to understand and screen for these variants, specifically the B117 variant, which is, I think, really the variant that we're most concerned about in the US right now. So the way that we screen for that variant is by using a specific type of PCR from a company called Thermo Fisher and looking for this signature, what we call S-drop profile. We think that about a third of PCR tests that are being performed on Colorado specimens are being performed with this specific assay that is able to identify these S-drop, this S-drop profile. And so we feel like that's actually pretty good coverage for Colorado right now. At this point, we're really not seeing any clear trend that we're seeing any sort of increase in frequency of these variants in Colorado. There have been some reports that have come out recently nationally that have identified potential increasing trends in some parts of the country, specifically California and Florida have been mentioned. But at this point in Colorado, we've not seen a clear increasing trend based on the data that we have. We're working constantly to expand the amount of sequencing we're doing at our state lab and the laboratory partners we're working with, both our state lab and of course our commercial labs around the state, to really improve our visibility of these variants in the state. So continuing to try and improve the work we're doing, but at this point feeling pretty good about the capacity we have in the state and the fact that we don't see a clear increasing trend.
Thank you.
Great, thank you. DJ, I'm going to take it over to you.
Hi, this is DJ Summers, Fox 31. When will Colorado be done prioritizing the vaccination of the 70+ population?
Well, this is Scott. I'll take that question. 70 and up represent 78% of the deaths associated with COVID in Colorado. And so we are going to continue prioritizing 70 and up until all Coloradans who are in that age range have received the vaccine. We are adding other groups because we do know that there are other risk factors, and we do know that our vaccine supply is increasing. But 70 and up maintains our top priority until we get a vaccine to all who want it.
With that in mind, what is the state's response to the 70+ population reaching out to us at our station, frustrated they can't get vaccines, can't get appointments, et cetera?
Well, we're continuing to work with all of our providers to ensure that they have accessible phone numbers and accessible websites that allow people to easily sign up to get vaccinated. We continue to work with our community-based organizations to stand up clinics across the state, both large and small, to ensure that we have access. And we will continue those efforts until all who want this vaccine have gotten it.
Thank you, Dr. France.
Taylor, I'm going to take it over to you.
Hi, Taylor Summers for NBC News Radio in Colorado. I read a report this morning out of Utah that they actually expect the number of vaccine doses that they are receiving from the government to start tripling sometime in March. That's in part because the Utah Department of Health anticipates the Johnson & Johnson vaccine that is going to get FDA approval. I was curious if you are expecting a similar sort of jump in allocation in March as well.
So we are seeing some very promising information coming from the Biden administration about a significant increase in supply in the coming weeks and coming months. And so while we don't know exactly what that number is going to be, we are preparing for a significant increase in that vaccine. We are working with our providers across the state to ensure that they are prepared to increase their efforts so that we are prepared when we do receive that extra amount of vaccine.
And kind of to go along with that, would you be able to say how that impacts the distribution timetable and what sort of methods you would use to get those extra doses out as quickly as possible?
The distribution is not necessarily the biggest challenge right now. The vaccine is allocated to us by the federal government on a weekly basis. We work with our providers to ensure that it's direct shipped there. We do some redistribution as needed. But what we're really looking at is making sure that our providers are all prepared to have an increase in their capacity to provide this vaccine. That we are continually increasing the resources that we have to support them, looking at our vaccine support teams that are going out and doing these clinics across the state, looking at our partners like UC Health and SEL and Centura and National Jewish that are doing these larger drive-through events, and making sure that we have access to vaccine for all in any number of different ways.
Great, thank you. Seth, I'm going to take it over to you.
Thanks. This is Seth at the Gazette in Denver and Colorado. Kind of piggybacking on the Johnson & Johnson question, does the state have any idea on when that vaccine may receive approval? I know obviously an exact date probably isn't possible, but if you have some sort of rough idea. And second, if you guys can talk a little bit more about the equity clinics, how those are going to be run, where they're going to be run, that sort of thing. Thank you.
It's Dr. France. I'll be happy to start. The Johnson & Johnson vaccine, Johnson & Johnson vaccine was submitted to the Food and Drug Administration for review for emergency use authorization earlier this month. The Specialty Advisory Committee that's called Vaccines and Related Biological Products Advisory Committee, or VRPAC, meets on February 26th to review the data. So that's the last Friday of the month. The Advisory Committee on Immunization Practices, ACIP, will likely meet shortly thereafter, as was the experience with the Moderna and the Pfizer vaccines. So we're expecting that if the data is strong and approval is given for an EUA, that we would know that by the first week of March. And J&J has said that they will provide 100 million doses to the United States by June 1. And so if we're talking March, April, and May distribution of 100 million doses, that's roughly 100,000, if not more, coming to the state of Colorado every week. So certainly if J&J is licensed, we'll likely double the number of vaccines we'll be getting in the month of March, then add to it extra doses coming from Moderna and Pfizer. And you can see why we may go from 100,000 to 200 or 300,000 doses a week, requiring the kind of preparation that Mr. Bookman described earlier with our provider partners. We are working to set aside a set amount of vaccine, 10 to 15% of all doses received, to use in specially tailored efforts to improve vaccination rates in communities with higher disease. And so as you heard, a series of events set up in local pods. We do this in partnership with the healthcare systems and the local public health agencies, as well as other community groups, to decide where and when makes most sense. So there's this constant conversation going on between the state with the LPHAs and the health systems to make sure we're coordinating where best to build these programs. In addition, we executed a public health order last week asking for race ethnicity data be provided for anyone who's vaccinated, as well as a vaccine equity plan for any entity that provides more than 975 doses a week. Those vaccine equity plans are due to the state by February 25th. And the hope is that that will create conversations with our vaccinators to be sure that we're focusing on where we have opportunity to improve vaccination in our communities of color and communities with higher rates of disease.
Thank you.
Great, thank you. Andrea, I'm going to take it over to you.
Hi, it's Gary.
Oh, hey, Andrea, sorry about that.
Oh, sorry.
Andrea Dukakis, Colorado Public Radio. And I apologize if this has been asked. I had to step away for a minute, but a two-part question. I wondered about modeling for the variants, particularly B117, and what you guys are projecting in the upcoming weeks, months for that, and whether the kind of leveling out of cases and may have something to do with these variants accelerating the spread. And then the second question is, we just got something from a listener who said his parents' second vaccine was delayed because they said they didn't have enough and it was delayed a week. And I wonder if that's happening a fair amount in the state.
This is Rachel. I can start with the first question. So, I think it's important to talk a little bit about how we use modeling projections. So at this point, we don't have a clear sense of how rapidly these variants might spread in the state or in the US. We have, examples from the UK, but the UK was in a very different place in their epidemic. They were in a growth phase of their epidemic, which we are not in right now in Colorado. We've got declining rates, and actually the same holds true for most of the country right now. And so, we don't necessarily expect the experience here to be exactly the same as it was in the UK. So I think right now we're using the modeling to really try and look at a variety of scenarios, to look at a slower introduction of the variant, a more rapid introduction of the variant. And then obviously we also look at, the intersection of increasing rates of vaccination with potentially increasing numbers of variants circulating, to really try and understand what the next couple of months in the state could potentially look like. We certainly do see, if we see the number of variants that are circulating in Colorado grow based on our modeling projections, what we end up seeing is more cases occurring, more hospitalizations occurring, more deaths occurring. But what we also see is, if we're able to maintain the level of transmission control that we have right now, meaning the mask compliance we have right now, the social distancing practices that are working so well in Colorado right now, if we're able to maintain those, we actually see very little impact from the variant. And that's really because we can overcome, I think, some of those challenges around increased transmissibility by really maintaining all of the things that we're doing to suppress transmission right now. As far as our trends and leveling out in cases and hospitalizations, at this point, we don't have any clear evidence in the state that we are seeing the variant spread at an increasing rate. We continue to see, in the range of 1 to 3%. And so again, we haven't seen a substantial increase right now that would lead me to believe that specifically that is why we're seeing a slowing of our declining cases right now.
And Andrea, in regard to your second question there, we haven't been hearing of delays as you describe it. We know delays might happen. There could be personal delays. I can't be there next week because I'm involved with something else, or I'm actually sick or something. So the CDC tells us, first off, that you can get your second vaccine up to 4 days early, and it still counts. And up to 6 weeks late, up to 6 weeks, I should say, instead of 4 weeks, 3 or 4 weeks, you can go 42 days after your first dose and still be within what their recommended area was. And to date, we're not hearing from our vaccinator partners that they're having delays. We're doing a good job at making sure they're getting all the needed second doses so that we keep people on schedule with their third, either at 3 weeks or 4 weeks, depending on which vaccine they had received.
Great, thank you. Ashley, I'm going to take it over to you.
There, this is Ashley Michaels with Fox 31. I'm hoping you can just kind of clarify a little bit about Colorado's vaccine supply. I know as a state, we're allotted the 90,000. So I'm kind of wondering, the vaccine doses that go to pharmacies or community centers, for example, is that in addition to the 90,000, or how does that break down? Maybe you can use this week's numbers or last week's numbers to kind of illustrate what we're getting and who it's going to.
So I want to start with, this is a constantly evolving situation, and we are getting updated information and updated communication from the federal government on sometimes an hourly basis. And so what we learned yesterday is that there is an increase in supply from 10 million doses to 11 million doses at the federal level, and that is going to be going directly to the states. In addition to that, the federal government is now activating the retail pharmacy program and is allocating a certain amount of vaccine directly to those retail pharmacies. And additionally, they're starting this new federally qualified health center program where they again are allocating vaccine directly to those federally qualified health centers. We haven't even seen numbers on what the federal government will be allocating to those community health centers starting next week. And so we, as of today, will receive approximately 90,000 new doses next week in Colorado. In addition to that, there will be a certain amount going to that federal pharmacy program, and then another amount going to the federally qualified health center program. Those numbers are still to be determined.
Okay, thank you.
Great, thank you. Anusha, we'll take it over to you.
Hey, this is Anusha with 9 News. Oh, this is Anusha with 9 News. I had a 2-part question regarding the variants. Just to make sure that I understood correctly, is the dominant strain of the virus still the original one that the vaccine is the most effective against in Colorado? And now that we are seeing more variants, what does that mean for the longevity of COVID sticking around in our communities, even beyond this vaccine rollout?
So since the beginning of the pandemic, there have been different variants that have emerged. And I think it's, when we talk about variants, we talk about RNA viruses, it's important to know that these viruses are constantly mutating, and we see smaller or larger genetic changes that happen in these viruses over time. And so, the virus that was first identified in the US is probably a bit different from what is present now, because these genetic changes can accumulate and these viruses can drift, is sometimes a term that we use to describe these small genetic changes that occur. And so when we talk about the predominant strains or variants that are circulating in the US right now, those are obviously distinct from these emerging variants that we are specifically tracking because they have these concerning characteristics. So at this point, we, in Colorado have not seen any sort of significant growth in one of these variants causing disease in the state. So, we continue to see sporadic cases of the B117 variant, and then also the L452R variant under investigation that's been identified in California and Denmark. So at this point, we haven't really seen significant changes. As far as longevity, I would say that the most concerning situation would be if we were to identify variants that resulted in decreased vaccine effectiveness, or if we saw variants that escaped our existing immunity and resulted in more reinfection. Those would be the most concerning scenarios. We really aren't seeing that right now with the B117 variant. There has been some of those concerns with some of the other variants that are circulating across the globe, specifically the variant that has been causing and identified in South Africa, and also a variant that has been identified in Brazil. But at this point, those variants have not been identified in Colorado.
Thank you.
Great, thank you. Gary, we'll take it over to you.
Hi, Gary, Denver 7. With the federally, I know that Walmart is supposed to be administering the vaccines nationwide on Friday. Wanted to see where we were with that, how that's going to look, how many vaccines Walmart will be getting, how people should sign up, things like that we can get out there. We're getting a lot of questions regarding that. And also with that, to follow up on that, what does that say as far as even a larger scale of widespread distribution of the vaccine now that one of these major retailers are taking over and chipping in?
Well, again, we're really excited to see this increase in supply coming into our state. It is being directed directly by the federal government, and we're still trying to get true clarity on exactly how many doses each one of these facilities is going to be getting. But we do know that for many Coloradans, the easiest way to access this vaccine may be at their local pharmacy. And so we're excited to see this. We're trying to get a better understanding of exactly how much vaccine is coming in. And when we have that information, we'll certainly be able to share it with the public. One of the great advantages of these pharmacies is their ease of sign up. And they all have open web portals that are very easy for the public to access. They can call. And so, specifically for accessing the Walmart program, we would encourage people to, go directly to the Walmart website, go directly, call your local Walmart and figure out exactly the best way to get scheduled for vaccine there.
Just to follow up on that real quick, Do you know for sure if Walmart will be starting here in Colorado administering the vaccines on Friday, like it's supposed to nationally?
That is our hope. Again, until the vaccine arrives and until we actually see those appointments being scheduled directly by the Walmart, we won't know for sure. But that is what we are told is going to be happening, and that's what we've seen in the system so far.
Thank you.
Great, thank you. Jamie, I'm going to take it over to you.
Thank you. Jamie Larry, CBS 4 News. I'm in Summit County here in the Mountain Newsroom. We have one of each of the new strains here for a total of 2 of the cases, and the county is hoping that they'll be able to have the ability to test for or screen for the variants more coming up here in the near future. So I guess, how does that work? What's the availability like for testing for this new variant? And then will all tests start to evolve to include the emerging variants, or are we going to have separate tests for all of these?
Okay, where to start on that one? Okay, so we have been in regular contact with Summit County and are working with not just Summit County, but a number of our mountain communities where we are seeing continued higher rates of disease transmission to get additional specimens from those counties to our state lab to really enhance the surveillance that we're doing in those communities to look for variants. Obviously, in places where we're seeing higher disease transmission, that's an area we'd be particularly concerned about, and an area we'd want to have greater visibility on what might be happening in the community. So those communities are certainly going to be a priority for us. And then can you repeat the second part of your question? Sorry.
Sure. Basically, what is this going to look like down the road as far as screening for the variant goes?
Sure. Okay, so the B117 variant is pretty unique in that it has this signature on our routine testing, our routine PCR testing. The other variants don't have that. And so to identify these variants, we have to do whole genome sequencing, which is we have to look at the entire genetic code of the genome of the virus to really look for these specific mutations that are associated with these unique variants. It's quite possible that there could be some diagnostic tests that are developed in the future to look for some of these genetic changes. But I would say that whole genome sequencing is going to continue to be a really important strategy for us to maintain our situational awareness for these variants, but also to be able to look for new variants that might emerge. So if we were to see, different mutations occur in these viruses, we want to have these sequencing programs in place in state labs across the country so that we can really identify any of these new genetic changes as they spontaneously occur in Colorado or anywhere in the US.
So where the basic test won't detect the other variants, will we have to get new supply of entirely different tests to detect the emerging variants?
So they're different types of tests. I think that there's ways to potentially modify how we do PCR to specifically look at some of these unique sequences that are associated with these variants. So it could be that there are opportunities to adapt how we are doing PCR testing. But I think that work is probably still a little ways off. I'm not aware of any sort of new specific diagnostic tests that are looking at these variants specifically. I think we're continuing to really rely on whole genome sequencing.
Great.
Thank you very much. I appreciate it.
And Erica Meltzer, I'm going to take it over to you.
Yeah, thank you so much. This is Erica Meltzer from Chalkbeat. We are continuing to hear from teachers who feel like their district hasn't really told them very much about how they can get vaccinated, or the district is not sure what the availability will be or how they'll be able to provide that information to teachers. And you did send a letter out saying that you would be setting aside 30,000 doses a week. And I was hoping, I think this is a question for Scott, but I was hoping that you could explain sort of exactly how do you distribute that 30,000? Who are some of how do you distribute it among the different entities? And what should teachers be doing if they're not hearing anything from their school district?
Yeah, I'm happy to take that question. And I think, to start with, we really want to encourage, our teachers and other educators to work with their school districts to get these answers. We have done a lot of work, surveyed our school districts, surveyed our providers to have an understanding of which school districts and which providers are working together to provide these vaccines to educators. And then that is how we actually determined our allocation of doses that set aside this week of 30,000 doses, and the coming weeks, that similar set aside, to make sure that we've taken the data that we have that was provided to us by our by our school districts, by our providers, to make sure that they had the supply that they needed, and then they were working with their school districts and with their educators to get them signed up for that.
Great, thank you. And with that, we do have to cut it off for today, but I just want to say thank you to our speakers, as well as our interpreters, and to all of you for joining us. We really appreciate all of your time. And if we did not get to your question or your follow-up question, please send that over to media_info@state.co.us. And with that, have a great rest of your day. Thank you.